Well, hello everyone, and thank you for attending our Axiom live chat with industry leadership. My name is Holly Foxworth. I'm a registered nurse here at Axiom Medical, and I'm also joined by Axiom's president and CEO, Mark Robinson, and also vice president of Human Resources and Administration with BJ Services, Malcolm O'Neill. So welcome to the live stream, gentlemen. We're so pleased to have you.
Excellent. Thank you.
Great
Yeah.
to be here and in such good company too.
Absolutely. Well, before we get started, and since it's been a little while since we've had you both on, let me have you both introduce yourselves and tell us a little bit about what you do. Mark, would you like to start? We'll start with you.
I'll happily start. My name is Mark. Sorry, just trying to silence my phone. I thought I had it silenced, and I just heard it. My name is Mark Robinson. I'm the CEO of Axiom Medical. I've had that wonderful privilege for 4.5 years. It is without doubt the best job I've ever had. We have a mission that I can believe in 100% and that everybody who works here believes in, and that is to help our clients by helping their employees with their workplace-related health challenges. And I have a great team of people. We have been surviving COVID and actually working very hard to provide our clients with services that help them survive it too.
Great. And Malcolm, how about you?
Excellent. Thanks, Holly. Malcolm O'Neill. I'm the Vice President of Human Resources here at a company called BJ Services. We're an oil field service company based here in Houston, Texas. And then we have operations throughout North America and have, actually are a client of Axiom. And, we've been on board with Axiom since the beginning of our company back in 2017. And, obviously started with a more traditional occupational medicine support and then have been, accelerating that into a lot of the new protocols that we have set up, around our entire, almost like COVID response care and everything that we have set up with the team.
Great, fantastic. Well, we've all experienced a lot of significant changes in our work environment that have been brought on by the pandemic, kind of spurred by the pandemic there. But one of the most notable has definitely been the focus on employee health and really maintaining those healthy workplaces and workforces. But you've both been so instrumental in really not only helping employers to navigate the pandemic, but also admirably advocating for the health and well-being of employees. And so today I'd really like to spend some time talking about what comes next. What is the future of employee health? So Mark, let me ask you, what are some of the factors that are actually driving employers to question that framework that relates to employee health?
Actually, the COVID-19 pandemic has been a key factor for many organizations. I think a few thought-leading organizations, not least Malcolm's team and BJ Services, have been looking at this for much longer and have been innovating in the space for much longer. But for most people, it was driven home hard to them that they had a vested interest in employee health and in the personal health of employees when they began to understand that actually personal health factors deeply influenced the degree to which employees were vulnerable to COVID or not. And the need to understand from a population perspective how many vulnerable people they had, what measures needed to be taken to protect them, how they could actually provide good information and guidance to each of those different groups in their demographic that had different vulnerabilities, and what kind of accommodations, workplace accommodations, did they need to make to ensure their safety. So that was a really big wake-up call for many of our clients.
Okay. Malcolm, do you have anything you want to add to that?
Yeah, I would just, almost like say ditto. And, I think it's just the wake up call that all of a sudden it's matter. And I think it's one where, all of a sudden what look like maybe some ancillary, nice to have things like that. But, mental health programs, paid time off, family leave, flex programs, childcare benefits, all of a sudden became mainstream foundational elements of how you put your business back to work or how you maintained that rigor. But also, too, it was really a juxtaposition because most businesses are not good at this. This is not a core competency of running a business in terms of running benefit programs and having access. It's almost like an albatross around the organization to say, okay, necessary to have it to stay competitive, but is it really a differentiator? And then I think that's that last piece right here is that framework has shifted where all of a sudden, I always say too that personal health and safety, workplace safety or total worker health has become the new engagement factor. And that really is a differentiator for companies and for employees and for teams to differentiate themselves out there in the marketplace and actually meet their employees in the moment. I think, it is unprecedented what our employees and their families are facing in 2020, and the ability not to wait till open enrollment or to say, well, that'll be something we look at next year, but actually to accelerate the adoption, to accelerate the maturity path for a lot of these things that were viewed maybe as nice to have, to make them much more mainstream, because it goes back to that benefits really matter.
Absolutely. Well, talk to us a little bit about what's next for employee health management.
I'll let Malcolm go first on that. Malcolm has been a visionary leader in this area, and in fact, I have to say that much of the changes that we've driven at Axiom I have to thank you to Malcolm for asking the question. And repeatedly and consistently asking
as well said,
as a service vendor, you're only the best customer. So
yeah, exactly. I think to Mark's, the little bit of back brief there is when the pandemic first started or set in, we were in a daily kind of almost like triage call with our team at Axiom, and and then we had a wrap up call at the end of every day, and in addition to running what's next, the resilience, like where do we today to what's next. And one of the things that we're really seeing next is mental health. And I think it's, I don't think it's anything necessarily new. I think it's just the fact that it's been easier to say mental health because people are able to say, wow, I get it. The world's stressed right now. And for us, what's really, I think for us is think about mental health in the sense of a business context is it's just another risk. But every risk that we can upstream remove from the workplace or eliminate or kind of mitigate is a better opportunity for the work there. And I think for us, we've had to challenge ourselves. Do we have the right mental health partners out there in our ecosystem? And, in many cases, our medical plans have a limited number of visits that a employee can actually have access to. But we know mental health care is just as important or as critical as any other type pieces, but yet we then limit the number of visits. And everyone says, well, okay, that's not that big a deal. I'm like, well, time out. What about if we limited the number of visits that a cancer patient had with their oncologist? Mm-hmm. And we said, okay, it's visit number 6. You're done for this year. Come back in 2021 and we can pick back up, or just pay out of pocket. We would never think about someone's continuity of care that way, but yet in the mental health care space, we do that. So on a kind of a quick personal vignette story is our first 2 years of business, we went through 3 fatalities that had a mental health or an addictions, root cause element there. And our best after action reviews, we were doing nothing more than talking about crisis support, how quickly we were able to provide grief counseling and really working downstream. And it really came to us that we really said, how do we get upstream? And that's really caused us to really rethink about how we actually engage the workforce about this. And, this even dives into some of the work that we've done with Axiom, where we've thought about, wow, what about when someone comes back off of a furlough or comes back after an extended period of time where we know that they've had this? What about if there was a psychosomatic pre-qualification? It's just a simple little piece that we're able to triage that population that could need a more, heavy hand back into a pinpoint solution right there. And rather than waiting for the problem to show up, it's made us really think about how do we go upstream? I mean, we know how to think about putting someone through a traditional functional capacity exam for any heart-related arrhythmias or any stress tests like that they would be working with. And, we actually have that service through Axiom. And, over the last 3 years, we've hired 10,000 people, and we screen out about 1% of our population for functional capacity. Well, what's that 1% that we're not necessarily trying to screen out for, a mental, hardship there, but what about if we can drive them into the right continuity of care or the access to care? And I think that's been a really big wake up call for us, is to say, we have to behave differently. We just can't assume to say, well, if we talk about it more, we're going to get a different outcome. We actually had to change our work processes and really think differently about that. and also demand more of our health system. And I think that was a wake-up call for us, is to hold our ecosystem accountable to say, how are we showing up for our employees?
Good point.
Great points. So sure, mental health, emotional health are really at the frontier, and they're mainly at the frontier because as a society and as employers, there is still systemic bias against mental health challenges. It's a taboo subject. It's really hard for people to come out and admit to themselves or to others that they actually are enduring a mental health challenge. Stress. The stresses that we've, as a society, had to live with for the last 6 months have absolutely amplified that, and the rate at which employees are falling out of the workforce or enduring really serious physiological and financial consequences because of mental health issues and emotional health issues that could have been addressed had it been okay to talk about them, okay to put them on the table. That rate is a penalty that we're all paying for. We as employers pay for it in the classic measures of lost productivity and lost institutional knowledge, but we also pay for it in the additional stress it puts on our own organization and in the cultural judgment that the rest of our team is making about us when they see whether or how we're supportive of those team members who do have those kind of challenges. It's been a long journey from the old days when mental health issues resulted in effective imprisonment of people. And unfortunately, though, we're still consigning many of them to isolation rather than actually driving the right way to handle and support these issues. I think beyond mental health, though, I think we're moving into an era where population health as a concept, which is rooted in public health. It's about looking at groups of people, typically the catchment area of a hospital, who are supported for their complex medical services by that hospital, and trying to identify pockets of disease, of illness, of risk, and then providing preventive services to address those. And I think we're in the process of looking at, or moving towards looking at, a group of employees working for an employer as a population. And there are a whole lot of statistical and demographic and analytical tools that will let us see what the propensity for a variety of different conditions is, and to put in place proactive and preventive measures. And even further than that, we're beginning to see employers talk about things, and BJ Services was one of the first that I heard talk about things like providing employees with wearable devices that do continuous biometric monitoring, not for the benefit of the employer, who would not directly have access to individualized data from on those employees, but for the benefit of the employees themselves, who through third-party monitoring would get early warning of adverse health events, the propensity to, let's say, diabetes or heart disease or hypertension, and even mental health challenges can be recognized by physiological symptoms. Panic attacks, for example, have a pretty distinctive physiological signature. And so, I think following the mental health road, but also extending the employer's willingness to invest in health into the personal health arena without compromising the employee's right to privacy. And I think that's where health benefits are heading to. Imagine if, because your employer paid for a service, you got early warning of a heart attack and were able to get preventive treatment, or you were made aware that you were actually exhibiting signs of extreme fatigue, and therefore you shouldn't get behind the wheel of that over-the-road truck that you're about to drive for 10 hours nonstop. Those kind of things, that the value return for individuals, for employers, and for society is huge.
Wow. And that also plays into the discussion of revising some of these policies that are associated with that. Malcolm, do you want to maybe speak to some of the policies that need to be revised in terms of maybe sickness or absence, and how it is that you can eliminate some of the stigma that's associated with those?
Absolutely. I think we always associate, well, we can't go there. HIPAA doesn't allow us to ask that. And so what I think for us, what we took advantage of is, under that mantra of never let a good crisis go to waste, we accelerated a lot of the ideas that we were road mapping out there. Mark referenced the wearable strategy, and our wearable strategy was initially targeted towards sleep data and the ability and the fatigue factor that, as we were diagnosing the root causes around our, physical reasons why that we weren't able to, while we were having failures in our job safety programs. What we were able to do is accelerate that, and then the policies really allowed us to take a different look at it to say, well, wow, how do we get people to opt in for this? How do we get people to share that data? There's a level of trust there that we're not trying to, use this to say you can't do, we're going to treat you differently here, but how do we get them to buy into that collective risk? So our first piece was obviously the data privacy piece, and then understanding how we share that data among different groups and staying at arm's distance away so that, we're not necessarily holding that data. And so that was kind of our first hurdle that we had to accomplish right there, was that. And then also too, then really kind of rethinking what things like leave of absence mean, particularly here in Korea, where we're asking people to self-identify that they are a risk, they've come in contact with someone. And rather than it feeling punitive, how do we have then our leave of absence administration feel like it's actually a promoter for the company to say, okay, my role now as your leave of absence administrator is to help you get back into the workforce as fast as you can. Not keep you out of the workforce as long as I can, or be punitive, or create these, stage gating events. But my role here is to get you to return to work safely. Population risk out there that we have to, Mark mentioned that population again. So that was almost like, and we explained to our employees what the role of the leave of absence administrator was, that this was someone to help them maximize, their opportunity to return back, and, safely though, and, and to make sure we had that in place. And so, at any given point, we saw upwards of 10 to 15% of our population in a protocol being managed by a leave of absence administrator. And that headset game really changed for us right there to get the employee base to understand what that was. And I think we also too, as a company, we saw wearables. I'll go back to the wearables piece, because that was one where we underestimated the adoption rate. We really felt that it was going to take a little bit more of a selling job on our part to say, hey, here's why we think it's good. As we were rolling out our pilots, and our workforce typically works in 12-hour days, 15 days in a row, in what we call a hitch right there, we would actually see, and we would typically roll them into the new pilot program at the beginning of their hitch so that we could, help them, with the, get signed up on the platform and so forth. Once they heard that we were in a certain basin handing out the wearables, we were actually having employees say, hey, I'm about to go home for my 7 days. Can I come by at the end of my 12-hour shift after working 15 days nonstop? And I'd like to get my wearables so I can go ahead and get access to it. And then we started hearing questions like, can my spouse get access to this? And so, what happened then is the data sharing piece. Now, obviously, people were, drawn into this because it was something new, but they also saw that, wow, the company is trying to get in front of this. They're trying to help me. There's some early stages that the wrist temperature that's coming from wearables is that early sign. Mark mentioned the sleep data. The wearables company that we're working with just had their validation study published that there's a higher chance that 48 hours out prior to you ever testing positive on any type of COVID test, that your sleep data will actually be an early indicator right there. And so all of that data, and then us educating our population about that, they're like, wow, you're really driving this. And what we've been able to do is think about, yes, that's an expense for wearables. Yes, there's a monitoring piece, but when we look at the cost shift that's so much occurring in there, and the amount of travel and entertainment, or the amount of on-site training, or the facilities costs that are no longer there, and just say, wow, if I only just took 5% of that offset and just redirected that proactively out there in this space to actually get employees to understand how to use these new digital tools. I think that's the other piece too, is that the healthcare piece has gone on demand and digital. No longer is it the fact that I'm going to have a health drive or a benefits fair, and once a year, Monday through Friday, 8 to 5. That is really not how we reach that population anymore. So it's really just been this acceleration, and also to the expectation. I always call it the Amazon factor, this kind of construct of consumer grade experiences. I think that same consumer grade experience is now expected inside of companies' health and welfare plans. And one of the ways that employers have to make sure that that really works and we're getting the right spend and the right return on that investment is making sure that the data is interoperable. And Mark mentioned this earlier, that so that the data that we're bringing in from a Fitbit, while yes, it's helping the personal level right there and giving them that early signal if there was an arrhythmia, and they're getting benefits there. The real value comes when we start to aggregate it into population health data, and we start to then feed that data to our private medical plans. And that, we, the company, are not doing that. That's not, Malcolm hiring a bigger staff to do that. That our ecosystem of partners is really driving behind that, and that where we used to think about, hey, we'll get biometrics once a year through an annual health assessment or a health fair. The ability now to think about, wow, I get biometrics 365, 24/7, and then how do we drive that into our intercept model, and how do we take action on that data? It is really a game changer out there for us, and so it can be a win for the employees and a win for the company. And then in our case around this, we're actually back-ending our way into sleep data again. So the original construct we started with, we're having employees share their sleep data. And the thought around that population, where we work in small groups of 12 to 15 people, a supervisor being able to see a profile, not by individual, but by the aggregate population, like Mark talked about, to say 3 out of your 15 employees have a poor health or sleep score coming into this shift. And maybe that starts to triage a red, yellow, green type diagnostic of how they would then take action. And so that ability to be intentional and to be early preventative allows us to continue to de-risk every situation we have. And for the employees to say, wow, this is great benefit for me at home, but also a great benefit for my coworkers here, for us to identify those risk mitigation factors.
Great. That's so true. Just pick up on a couple of those points. Mm-hmm. Look, cost. Whenever we're in a conversation with a client about changing their leave of absence policy to reflect the necessity to support employees who, for example, have been exposed to COVID or who actively have COVID, and the federal government has done some work that's helped with some of that, but that's all transient. So what we're seeing is that the cost avoidance way offsets the short-term cost uptick. So, for example, if you make your leave of absence policy more generous and you focus on early intervention and prevention as your primary investments in healthcare, then you're avoiding massive downstream costs. Mm-hmm. The costs of the many employers are self-insured. Certainly, we are. I don't know about BJ, but I think we were, and that means that you're bearing the cost of that illness, right? So, a lower back sprain, typical cost $50,000 in medical treatments, right? If you can avoid that because you know that employee's perhaps vulnerable to injury because they haven't been sleeping right, maybe they haven't exercised very much, whatever, and you're able to early on start counseling that employee, not as the employer, but through your arm's length provider, you can avoid that whole 50K. But not just that lower back sprain occurs at work, and therefore it's a work comp issue, it's a OSHA reportable issue, and work comp, your work comp claim may not be huge, but the rate at which you experience claims significantly influences the size of the premiums you pay. There's a multiplier effect, right? If you're deemed to have a loss run record that is normal, then you're going to pay the list premium for a business of your size in your business. However, if you have a higher loss run rate, you're going to have a multiplier, and that can go up to 2 times or more the premium costs. And for a medium-sized organization, those premiums are in the millions and millions of dollars a year. Okay, so there are huge cost savings opportunities, and then there's also the lost productivity opportunity. People who get severely injured are non-productive for longer. And also people who have deep-seated personal health issues that haven't come to the fore yet, and particularly emotional mental health issues, their productivity begins to decline on an identifiable path. And so if you're able to intervene early, you're able to avoid all of that lost productivity. And then the final thing that I really, really want to emphasize is that we live in an era where our fellow Americans are more and more focused on caring capitalism. The old paradigm of all you care about is shareholder value, that is beginning to fall away, and we're beginning to see social responsibility become an actual key metric for how a company's performance is assessed. And social responsibility, in great part, starts with the health and welfare of your workforce. So I think there are many, many arguments to become a more enlightened employer that are both financial and reputational, alongside the basic thing, which is my everyday mantra, which is, guys, do the right thing.
Right.
Yeah.
Don't think twice about doing the right thing.
Right.
Yeah. Well, then, my final question, I guess, and we've kind of alluded to this, previously in some of this discussion, but it comes to the what and to the how. How is it that you're able to actually make this transition? How are you able to adopt some of these new practices?
Yeah, I'll maybe take a first kind of vignette. Is I think it's one is changing our own expectations.
Sure.
I think it's one too where, a quick little story is we actually had a COVID fatality back in July. And, if there's a silver lining to a horrific outcome here, was how fast we were able to respond, how fast that the data from the minute that we found the test, and we actually run our test results through Axiom, and that data was able to go to the private healthcare plan contacts the family, and instant contact tracing for that whole piece, that we took that off the table. So the family was able to say, okay, I know I'm safe. And so how do we get to this situation? And then how do we then respond so that the workforce feels that, well, that was our expectation, that we knew how to respond in a crisis, and that we would have our partner and our ecosystems be able to support us in that model. And so, here we are, day 60 into the crisis, so to speak, where we've turned on all of these protocols, and we were able to respond and not miss a beat. And, our business, yes, they're, mourning the loss of a coworker, but yet business does go on, and we've got that continuity factor, and they feel safe. That's probably the biggest piece. It's not that they didn't forget it, they felt safe, and we had built that around that. And I think that's the biggest piece, is that if your employees don't feel safe, your business won't work. And I think that's the acceleration where our expectations were going to raise, to say, wow, we know this is going to outlast. We don't want this to outlast us. We want to outlast this, but it is the new normal. It is not going away. And so then we have to change our expectations. We have to change how we're going to be setting ourselves up. And a lot of that is not to think about, well, okay, I can't hire more staff. That the economy does not support that. But it's then raising our expectations of those that are in our ecosystem. In our case, it's just been a tremendous partnership that we've, had with Axiom here, that has allowed us to really increase our capability to the business. And like Mark was alluding to, take cost out. And when you can do both at the same time, of your foot on the gas and the brakes, so we're accelerating that safety factor, accelerating the decision support to the business, but continue to find ways to say, wow, who are the experts in this? How do we take cost out? That's really been how I think employers can accelerate into this new world of working that we're in.
I agree completely. The role of HR is fundamentally shifting. In the past, HR has been viewed in two ways: as a provider of routine administration, and as a source of human capital and human capital policies that enable the development of human capital. And I think we're moving into an era where the role of HR is much more as an integrator of third-party services, of internal systems and solutions and services and policies and processes, so that an holistic view of employee health can inform all of those decisions, and so that managers and senior leadership have the ability to look at that problem from a a whole problem perspective rather than a fragment of a problem. What we see in traditional HR is that HR is often a marginalized contributor in a business, that they don't have a seat at the table where the really important things are being discussed, and that they're not recognized for their advocacy for the workforce. And I think that is, again, a paradigm that is shifting. Third parties are a way to extend the reach, breadth, and depth of the skills in an HR department, but they're also a way to extend the organization's capability, and particularly in our area of interest, in health and safety. And trying to do that in-house is prohibitively expensive, and it's really hard to source the expertise that you need to sit at the table with you day after day, hour after hour, on a hired for work basis. So we've made huge investments in many of our client relationships around becoming that trusted advisor and partner. It isn't easy. In many cases, it's that we have to take a less cost-sensitive, more outcome-oriented view and take more risk than as a provider we would historically have taken. And I know that Malcolm's ecosystem that he refers to includes several other really great companies, and that they've also taken that same path of making an investment, assuming more risk, usually financial risk, and making taking a big step down a long road.
Right.
Yeah, good points. Great information. Well, thank you both for taking the time to share with us today. Do either of you have any closing remarks before we conclude here today?
Yeah, I would just like to share I would just like to share to you and Mark and the Axiom community, and really just your constituency group at large, is just the fact that we can do better. And I think that's the challenge that, Mark mentioned earlier, that we were asking a lot of good questions. And, when you get around that thought leadership and not, this is the normal that we're in, and we're going to, 2020 is really a breakout year for many companies where, our internal processes and the ability for us to intentionally, shepherd and really collide the two worlds of, workplace safety and the personal health and safety. All of a sudden the employee is looking for one answer. And I think that's been probably the biggest aha for us, is to say, wow, we need to get these swim lanes closer together of our traditional OCMED and our traditional health and welfare plans, and really kind of drive this into a total worker health. So I think that's been if I have to reflect back on what word are we saying more now 6 months into this pandemic than we were never saying before, it's really the construct of total worker health.
Yep, I agree. It's convergence, what we're seeing. And what I'd like to say is that any organization that is fortunate enough to have the kind of visionary leadership that Malcolm brought to BJ is fortunate indeed. And any vendor who has the opportunity to participate in a partnership like that, it can be painful, but it's a joyful kind of pain. I remember a few months back, a few conversations with Malcolm, he said things that made my head spin round. It's like, what? And then I'd go away and I'd think about it for a little while, and I'd begin to see that actually it wasn't crazy. It was the way ahead. And I think my company and I myself owe Malcolm a debt of gratitude for that. And I think ultimately we'll see that the industries that we serve, particularly in the Greater Houston area, that they will also recognize the pivotal changes that BJ Services drove and become adopters of similar processes and approaches.
You bet.
Thank you, Malcolm.
Yeah, no, thank you guys.
Well, thank you again, both Mark and Malcolm. We appreciate you joining. Just a few quick mentions before we do go. On Thursday at 1:00 p.m. Central, we're going to be hosting a follow-up live stream, and that's relating to last week's webinar, which was offensive strategies for defensive COVID testing. So that's going to have our Axiom's Chief Medical Officer, Dr. Scott Cherry, and Cedric Jones, who's worked in the NFL and is presently the director for the New York Athletic Club. So they're going to be taking all of your questions related to sports, schools, workplaces, choices and how you can definitely affect and manage your population health there. So be sure to tune in to LinkedIn, Facebook, and YouTube. And then if you've ever wondered how the Hollywood entertainment industry is getting back to business, we do have a new white paper that's available. Kind of gives you the inside scoop there, walks you through the multi-layer comprehensive medical approach. It takes you through zone testing for the cast and crew, and it even explains how we were able to significantly lower that positivity rate, which was significantly lower than the 7-day community average. So you can access a free copy of that publication on our website. And as always, should you have any questions regarding Axiom's Check Into School or Check Into Work, please be sure and reach out to us. We'll be happy to walk you through it. So thank you again for joining. We look forward to seeing you on at Thursday at 1:00 p.m. Central. Stay safe.